Hello everyone and welcome to STEM Club's week, AI, the World and You. We are delighted today to have Anna Studman, a senior researcher at the Ada Lovelace Institute, talk to us about AI and the future of health. Anna, welcome to this session.
Okay, thanks, Joe. And hi, everyone. As Joe said, I am Anna. I'm a senior researcher at the Ada Lovelace Institute. And the Ada Lovelace Institute is an independent research institute that aims to ensure that data and AI work for people and society. And that means that we want everybody to get the same benefits and privileges that are generated by data and AI and fight back when these technologies are causing societal inequalities. And my area of research is on AI and healthcare. So when we talk about AI and the future of healthcare, one of the first images that might come to mind is that of a friendly robot attending to the bedside of a patient in a hospital or a care home. And recently we've had the Prime Minister, Rishi Sunak, and the Health Secretary, Steve Barclay, talk about how robots could revolutionize care, especially for the elderly, sometimes pointing to Japan, where these images on the screen are from. And pictures like this often come up when talking about AI and healthcare, but in reality, these robots aren't all that common, even in Japan. And some studies have suggested they're not all that helpful either. Now, actually, a lot of the AI and healthcare here in the UK and around the world is going on more behind the scenes. So at the moment, AI in health is mostly used to help doctors make decisions or support them in their work by analysing huge amounts of medical data and returning results for doctors to look at and decide what to do next. It's not for replacing doctors, and I don't think that's going to happen anytime soon. So today I'll talk about some of the ways that AI is being used in healthcare right now in the UK, some possibilities for the future, and leave you with some challenges that I think are important to consider. I'm going to be mentioning AI, which, as you know, is the type of technology, and algorithms, which is the process the technology uses to analyze the data and do its problem solving. So firstly, analyzing medical scans. This is perhaps the most common way that AI in healthcare is currently being used in the UK. And so some AI technology can be used to read medical images and detect if anything is wrong. So, for example, detecting a cancer from X-ray images, or analysing chest scans like MRIs and CT scans to help with COVID treatments. And the way that this works is that the AI algorithms are trained to analyze many, many images at once, a huge amount and faster than a human doctor could do it. And it uses that wealth of information to detect anything that isn't normal in scans or compare them with other images to suggest treatments. But they don't always work the way that they're meant to, and some are more accurate than others. Ultimately, human doctors still know more about their patients and about medicine and the context of treatment in general. So they're still very much in control of the process. Next up is medical chatbots. And this is where some health apps use AI to help people check their symptoms and understand what their symptoms might mean. So, for example, if you're feeling sick, you could download a health app that has an AI symptom checker, tell the chatbot what's going on, and it will ask some follow-up questions and then offer some possible solutions of what you might be experiencing and what you should do next. At the moment, though, these apps are meant to be for guidance only and not professional diagnosis like you get from the doctor. And there have been concerns about the accuracy and safety of these apps, that users might trust in them too much to tell them what's going on when they don't have all the information they might need. They're still just chatbots after all, and they do get things wrong. And it's always better to check with the doctor when you're feeling ill. Then we've got risk prediction. So this is where AI-powered algorithms can be used to predict how at-risk groups of people are for needing to be admitted to hospital, or how at risk they are of getting seriously ill, for example, from COVID. During COVID, we had algorithms helping to figure out which groups of people should be seen as more vulnerable to the disease, and who should be prioritized for vaccines, for example. Again, a lot of data is needed to make these algorithms work and make sure they work for everybody. A big issue that can arise is if the data used to train the algorithm is not diverse or has important information missing, the algorithm might be biased. So, for example, in the US, there was an algorithm developed to identify patients whose current illnesses might predict a need for future hospital care. And because the data the algorithm was using showed that Black patients visited the doctor less often and spent less on healthcare, the algorithm concluded that white patients would need more care than Black patients. But in fact, there are a lot of important factors here, like medical racism and inequalities in access to healthcare, which would explain that difference in the data. But the algorithm ended up wrongly saying that white people would need more healthcare, therefore kind of effectively blocking healthcare for a lot of Black patients and reproducing the biases that exist in society. So again, it's important to have doctors and people overseeing the process, as algorithms don't have all the relevant information they need about patients outside of data sets. And there is definitely a risk of bias in these algorithmic decision makings. So what does the future look like? A lot of the technologies I've talked about so far are still in the relatively early stages. But you've probably noticed at the moment there's a big push for the development of new AI technologies, not least in healthcare. So one of the big ones that I think might be on the horizon is this idea of really personalized medicine. So AI could be used to help doctors tailor treatment to individual patients on a very, very specific level. For example, an algorithm could analyze your genetic information to provide a disease risk assessment that is personal to you. And then AI could also use this information with all of your past medical records to pinpoint the absolute best treatment for you. So again, it's using a huge amount of data and analyzing it very quickly, more than humans could do. So that could happen in a medical setting, like a doctor's office or the hospital. But AI health technologies could also make their way into our homes more as well, in self-tracking, like through a smartwatch or a wristband, which we are seeing the start of already with, Apple Watch being able to tell about your heart rate, but this could get a lot more advanced. I heard on a podcast recently someone talking about the possibility for having an ultrasound attachment to your smartphone. So you could do a scan on any part of your body at home by yourself and send that information to the doctor. So yeah, you could use that to communicate symptoms to your doctor, or in the future, it might just happen automatically. So importantly, to finish off, I think we need to think about what the risks and challenges are with AI in healthcare. And I've alluded to some of them already. As I've mentioned throughout the presentation, health inequalities is a huge one. It's a big challenge, and it may be worsened by the use of some of this technology. A big way this could happen, as I mentioned, with the algorithmic risk predictions, is that a lot of the health data we have that the AI technology needs to use and is trained on isn't very diverse, or there's important contextual factors missing from the data. So for example, again, people from ethnic minorities might not be well represented in data sets, and this can lead to the technology not working as well for them. Another example of this happening is a while ago, Google released an app that would check people's skin for skin cancer, but it became clear that 90% of the database that was used to train the algorithm was for images of people with quite fair skin. So it had no images of people with darker skin that it was trained on, and therefore it's unlikely that the app would work very well for people with darker skin. Inequalities could also arise through people being unable to use the technology because it's too expensive, or it's available at some hospitals and not others. It might be available at richer private hospitals and not at public hospitals that don't have as much money. So some people would see the benefits of the tech while others are left behind. Some other challenges are that we have to think very carefully about data privacy. All of this technology is using sensitive medical data, and it will possibly be much more widely and easily shared from personal devices to doctors and back, or through different personal devices. So if we're going to be collecting and processing much more data to power these technologies, we have to make sure it's protected. And finally, people might get too excited about the AI. We might rely on AI too much to give us the right answers all the time, to know everything, when, you know, it might not be able to do this. It's still just computing. We have to really be aware of the limitations of AI. That's it. It's an overview of what AI in healthcare looks like today and might in the future. And while there are some really exciting developments happening, it's always important to think about whether everyone is experiencing the benefits of healthcare technology equally, and how to use this technology that results in good health outcomes for everybody. So thank you very much for listening. I'm just going to have a look at, I can see there's a few questions in the chat. So, are there regulations in place to ensure that AI is regularly updating to avoid bias, etc.? Who should be responsible for these regulations? Very good question. Yes, there's a huge live kind of discussion at the moment about AI regulation that we at the Ada Lovelace Institute are very involved in as well. I don't know what the sort of regulations are in terms of the algorithms having to constantly update to avoid bias, but I know there are some data standards being proposed for data sets used in the development of AI in healthcare that would require people using the data sets or who have created the data sets to flag who was represented in them and who wasn't, and where bias might come from. So there are definitely proposals for that happening. And who should be responsible for these regulations? That's also, a big question. At the moment, we have the MHRA, which is the medicines regulator in the UK, stepping in to do some of this. But I think it's important to have sort of a variety of buy-in from stakeholders, and definitely not leave the regulations to be kind of steered and controlled by private actors. The next question is, how can we fight back, as you previously mentioned, when we see inequalities caused by AI? It's a good question. I think the way that we try and do it at the Ada Lovelace Institute is research and evidence. We always try and think critically about new AI technologies that are announced and think about the ways that different groups might be affected by new technologies. I think it's also important to bring diverse voices into the conversations. So people who might experience health inequalities already should have a say in how they're affected by healthcare technologies. They should, be able to share their perspectives on how they want to experience and access healthcare technologies and be informed about how this is happening. So bringing people into the conversation and, educating people and not having these sort of, at the moment, AI is a lot of the time developed in these kind of bubbles that are tech companies, and isn't always kind of talked about and shared with marginalized groups. So I think that's important to do. The next question is, can we trust AI with our personal data? I don't know. I think there's a big concern about doing that. That's why I think, again, AI companies need to be really transparent and open about how they are handling our data, what's happening to it, who can access it. But I would say, it's important to be very, very careful about using private health apps and things like that might have your sensitive data. Because at the moment, I think a lot of the time, data privacy by private tech companies isn't at the level that we think that, it ideally would be. So it's definitely something that we should be aware of and continue to demand that sort of transparency around what's happening to our data. The next question, I think similar answer, how can we ensure that our health data remains protected and isn't accessed or shared without our knowledge? Who should regulate it? Again, I think, we need public regulation of private companies. We need really stringent requirements for transparency of personal data and how that's handled. And yeah, we need really, really strong privacy regulation, which is beginning to happen in the EU, and there are conversations about how it's happening in the UK. So just important to make sure that private companies aren't allowed to sort of run away with developing this technology and using all the data sort of willy-nilly. Okay, the next question I really like, and I want to answer it, so I'm going to take a soother. In the future, could personalized AI health apps replace our local GPs? So I've done a project recently that we're going to publish soon about digital health services and AI in healthcare, and how people who experience health inequalities feel about the sort of acceleration of digital healthcare in their lives. And one of the biggest things that came out of that was that people really missed the relationship that they used to have with their GP, and that sort of personal doctor-patient relationship was really important to a lot of people experiencing health inequalities, who experience long-term health concerns, and want that continuity and that relationship with their GP. And so for the people that were in our research, what they really felt was that digital and AI kind of coming in to replace the GP was a really negative thing and took away that sort of personal nature of care. So I think, what is likely, what might happen, I don't want to make any predictions, but that this personalized AI healthcare could come in alongside the GP and could help people, with tracking their symptoms while they're in between GP appointments, and help them to accurately represent their symptoms to the GP, and then help the GP have that information to tailor treatments to people. But the best way that this could happen, I think, is that, if it freed up GPs' time to spend more time with their patients, the AI and the personalized healthcare is sort of supporting the GP rather than replacing it. I think that could be the most positive outcome. So yes, I think that's all the questions that we have. Apologies again for coughing through half of them, but hopefully you could interpret some of the answers through the coughing. And thank you very much for coming and listening. So I'll hand back to Jo now.
Thank you, Anna. That was absolutely superb. It seems very clear that as AI is developing, there needs to be this code of ethics, the regulations put in place, and that is a responsibility, not just for the experts, but for all of us to share and give our thoughts and take forward. I think for all of us, a little shocking that the data that is being fed to AI at the moment has these biases being fed into it. But I think that you've made it clear that that can be resolved by giving more data and making sure that as we feed it, we remove the biases as we go forward. I'm also kind of intrigued by the thought of personalized GP apps. And I think we all kind of still miss that human interaction of, it's somebody you can talk to. But I can see uses of where it's a very long way to get to your GP. So it's kind of like you could take it on your phone with you, say for students who are traveling, and they might get a little health concern and they can tap into their health app and it can give them, okay, this is what it is, this is what you need to do. I suggest you go and visit a real doctor or pop into the hospital. So I can see some uses for that. I'm not sure I'm quite personally ready, but AI is here. It's here to stay. It's evolving every single day, and I think we are facing an extremely exciting world, and we should be welcoming AI, but just be aware of the pros and the cons. So thank you so much for your talk today. Thank you very much to everybody who's asked their question. I wish you all very best of the rest of the day. Join in on the rest of the content for STEM Clubs Week. It's all available on our YouTube channel, and thank you and goodbye everyone.